I'm Toyin Opalami, Dr. Toyin. Um, Today I'll be starting a new series. It's called What We Say. It's totally unscripted, meaning I'm not reading from something. It's not going to be edited, and yeah, we'll find out if this is good at the end of the day. I'm sure my husband and my partners will let me know what their opinions are. But like I said, this is called What People Say, or What We Say, more like it. It's going to be answering some questions I hear people say, things I hear people say, like my father of blessed memory would say, oh, Moniba, this is my language, it means I have a fever. And when I ask him, oh, how high is your temperature? He looks at me puzzled and he goes, I don't have a temperature. But that's what fever is. So there are a lot of things lots of words we use that are not actually accurate. So in about 5 minutes, I want to talk about one of the things we hear people say. Lately, one of my friends, my colleague said, my tummy is hurting me. I have ulcer. It's my ulcer that is acting up. When I hear that, I look, it's not your ulcer, acting up. With all my doctor arrogance, but let me take this time to try to explain a little bit about what people commonly call ulcer. It's not actually ulcer. It is most likely acid reflux, or what we call gastroesophageal reflux disease, GERD, G-E-R-D. It's a mouthful, so we'll say GERD, or acid reflux, or heartburn. So what is this? And why do we have it? And why do I think when most people say ulcer, it's not actually ulcer, but GERD? So this feeling is, what people would come in to complain about is, oh, I have this recurrent pain in my tummy all the time, and I know at times is when I eat something and then it will last for a day or two and it will get better. For it to be an ulcer, you have to have evidence of ulceration, meaning there has to be a wound in the tummy. And the tummy is not, stomach is not a place that you readily see. You have to do endoscopy, which is that you take a camera down the throat and you take a look. It's the gastroenterologists or the surgeons that do this. They will take a look in the tummy and say, yes, indeed, there's an ulcer. Maybe it's bleeding, maybe it's not. There are other situations like gastritis, which is another big word, just meaning inflammation of the tummy, inflammation of the walls of the tummy. So when that happens, it can also cause pain. So why do those situations happen? Let me go back to my ulcer. Like I said, this is unscripted, so I might jump around a bit. So the ulcers, how would you know you have an ulcer, especially a bleeding ulcer? You might have symptoms which could include abdominal pain, which could include persistent abdominal pain. And if there's bleeding, you might find black stools. Black stools is that there's blood in the stool and it's been digested. And you might actually see frank blood in the stool. When you wipe, you see blood, or mixed with the stool, you see blood. And when they do an endoscopy, like I explained earlier, take a camera and go down the throat, they would see an ulcer or a wound that is bleeding. Other ways to know this, aside from the stool test, which would confirm that the stool does have blood, will be something like doing a blood count. So if you go to do your annual or your routine test, and you notice that, oh, my blood count as a man dropped from 15 to 14, but it's still within normal. But they checked my iron to see if I have low blood count, and my iron numbers still look abnormal, and I've been having this tummy pain. You should talk to your doctor. That is not normal. Even though 15 and 14 are still in the normal range for blood count, that's the red blood cell count, hemoglobin, hematocrit, it's not normal. There's been a drop that has not been explained. So in that situation, there might be a bleeding ulcer. You do a stool test, it comes back positive, there might be a bleeding also. At times there might be vomitus or throwing up, and there might be blood in it. Not streaks of blood, but frank blood at times. There might be a bleeding ulcer. And when we now talk of acid reflux, which is what most people refer to as ulcer, the symptoms are similar. There might be occasional pain in the tummy, and this would occur frequently. And what causes this pain is irritation. Why do we have acid reflux? I like to explain to my patients that this is a plumbing problem, meaning that there's the throat, the esophagus, it's connected to the stomach, right? I said I was going to drown. It's connected to the stomach. And when you have this connection, you can imagine, my drawing is not too accurate. You can imagine if you tilt, things in the stomach that you've eaten will go back into the throat. But with the way we were made, there are sphincters or valves. There's a lower one here, which keeps the things in the stomach. So when this valve is loose or lax, when you tilt at times, then food goes back up into the throat and it irritates, because the lining of the stomach has been designed to be able to hold the acid that is produced to help digest food. But the lining of the throat has not been designed that way. So when this happens, when there's a reflux, meaning food goes back up, when there's a reflux, then you would have that sensation of burning, you might have abdominal pain, and that is what is acid reflux, what most people call ulcers. So why do we have this? At times it's a structural problem that cannot be explained, but we know that there are some things that give us the tendency to have reflux. Obesity is always a big thing. We should all lose weight. We should all work on our lifestyles. We should exercise. We should see our doctors, ask them for recommendations on how to lose weight in a healthy way. I see my doctor and I talk about this. When we talk about other causes of reflux too, you would want to look at things like what you eat. Occasionally when you eat very acidic foods, things like oranges, things like lemon, lime, things like tomato, raw onions, those things are very acidic. And some people, beans, it's very acidic. And because you're eating something acidic and you're already putting it in an environment that has a lot of acid too, you can imagine acid plus acid is more acid. This can make one have a reflux too and might produce the abdominal pain. When you eat and you eat a lot, the tummy doesn't have anywhere to put it. It still has to be digested. So there's a tendency for it to go back up the throat. When you lay down less than 2 hours after you just ate, less than 3 hours ideally, like I said, this will tilt and the food goes back up the throat, producing reflux. Let me see, those are the things. And at times some medications, especially some medications that are being used these days, they tend to keep food in the stomach longer. And when food in the stomach stays longer, something that should digest in 3 hours is staying 6 hours. You're going to go sleep at some point in time. You're going to recline at some point in time. So when that happens, you tilt and food goes back up the throat and it burns. So how do people present when they have reflux aside from the pain? Some people might have difficulty swallowing. Some people might have regurgitation. They wake up in the morning with a bitter taste in their throat. At times they even throw up. You wake up in the morning, you're nauseated, you're like, ugh. At times you eat and you are unsettled. You say, oh, I have indigestion. So those might be signs, those might be clues. When this happens, what do? You want to talk to your doctor. You also want to change your own habits. You want to change your lifestyle. If you eat a lot, you might want to practice portion control. If you're obese, you might want to exercise. If you do have a sphincteric problem, meaning the issue with the valve, you might want to see your gastroenterologist who would recommend some things for you to do. They do the banding, they do surgeries, they do all sorts of fancy things these days. But before we get there, there are medications you can use. I'm sure you've all heard of antacids. I remember my mom used to call one Gelusil. Some people call it Tums. So using those medications would help with your acute symptom. But to prevent this, you can do things like PPIs or things like omeprazole, pantoprazole, or other things like H2 blockers. These are medications I'm mentioning, like famotidine, Pepsid. So I do not know the brand names. I just know the names, the generic names. So you can look for those medications and use them before you eat. What they do is to reduce the amount of acid being produced, and that way, even if food goes back up the throat, it's not burning as much as, or not burning at all as it would if it was a normal production of acid. So let me try to summarize. I'm sure I've missed a lot of things, because remember, this is totally unscripted and it's just answering question of, I have an ulcer. It's not an ulcer. So let me summarize again. So most of the time when we say we have an ulcer, you hear people say, I have an ulcer because my tummy hurts me recurrently and persistently. What is it? It's usually acid reflux. What is acid reflux? It's food coming from our stomach going back up our throat. And this happens when there's an issue with the sphincter. That is the valve between the stomach and the throat. That's usually the cause. And what makes you predisposed to this, or what makes this issue worse? If you eat acidic foods like oranges, acidic foods like lime and lemon. For everybody that does this lemon water in the morning to cleanse themselves, to lose weight, and then you have tummy pain, please talk to your doctor before you do things like that. And maybe you should lay off it. And things like obesity, lose weight, exercise, change your lifestyle. Things like eating a lot of food. You might want to cut down on your portions, practice portion control. And if you're using medications that's making you have reflux, you might want to talk to your doctor who started you on the medication as well, that this medication is making me have abdominal pain, is making me have nausea, is making me have difficulty when I swallow. Because the acid reflux in itself, let's say you can even live with it. There are some things you can't live with, which will be complications of the acid reflux. You can imagine if you have a wound, when it heals, you have a scar. The same thing if you have a wound in the throat, because the acid from the stomach is going to irritate it. When it heals with a scar. And with recurrent scarring, that space, that muscle that should be flexible and should open and should relax and contract normally would not do so. It would be tight. It might not do as it should. So in that situation, there might be a tightening in the throat, so that when food is going down, it gets stuck around that area. That's one. And at times, with recurrent acid and recurrent wounds and ulcerations and irritation in the throat, when wound heals, like I said, it heals with scarring, but some cells are formed, some cells are produced to produce that scar. And when you're asking too much of the body and the body is trying to meet up with your demands, there's a wound, oh, let's heal it. There's another wound, oh, let's heal it. In doing too much, it might not do it well at all. It might not do it as well as it should. And these cells that are being formed at times become dysplastic, meaning they don't look like their mother cells, they're abnormal. And with continuous production of those cells from one to the other, then you might find that that there's an occurrence of cancer. So from dysplastic cells, you can get cancer. And acid reflux has been shown to be one of the risk factors too for getting esophageal cancer, adenocarcinomas. And there's something called Barrett's esophagus as well. So these are complications from acid reflux. You can have the tightening, you can have the Barrett's esophagus, you can have the adenocarcinomas, and also the discomfort to your lifestyle, to your livelihood. If you're having recurrent abdominal pains, you're not going to want to go hang out with your friends. You're not going to want to eat. If you're throwing up, if you're nauseated all the time from eating little foods because you have acid reflux, you're not going to have a good lifestyle. So today I would recommend, again, if you're having the symptoms, pain in the tummy, persistent nausea or recurrent nausea, at times you wake up with bitterness in the throat. Some people even have issues with their teeth because the acid keeps on wearing on enamel, which is that covering on the teeth. And when the acid keeps on wearing on it, they might start having dental cavities in the back of their mouth. So things like this are pointers. So is it an ulcer? Most likely not. It might be acid reflux. So talk to your doctor about this. Thank you. Again, this is What We Say, unscripted.